Welcome to MIPS Tips for Eligible Clinicians with the QPP News team. Today we're bringing you MIPS Tips number 5 from the top 10 tips list. Understanding your quality reporting performance score.
So, do you remember in MIPS Tips number 3, we mentioned that the MIPS path included 4 quality performance categories? Those categories make up an eligible clinician's composite performance score.
Yeah, sure. Of course, I remember at least one of you talking about the composite performance score that each eligible clinician will receive. But what resonated the most is when Sandy said, starting in 2017, performance matters.
It's good to know you're listening to us. You're right. Within MIPS, each eligible clinician will get a composite performance score, or CPS, from 4 key component categories, with the highest score being 100 points. An EC can get up to 50 points for the quality category, 25 points for advancing care information, 15 points for the new category clinical practice improvement activities, and for 2017, the resource use or cost category counts for 10 points.
Well, while the first MIPS payment adjustment year is 2019, the first performance year is 2017, and clinicians still need to report their 2016 PQRS by February 28, 2017 for the care that they have provided in 2016. That's a little complicated, but understanding your current performance using your PQRS, your QRUR, and other reporting will be helpful to identify areas of strengths and weaknesses before you set performance improvement goals.
So the problem that I hear from my colleagues is that they perceive that their data is not accurate, and they would say it's just garbage. So how can we be fairly measured on what we perceive as inaccurate data?
Well, there's really no denying that there is a real challenge getting data from most EHR systems. But it's really vitally important not to let the lack of complete or perfect data be the enemy of good enough data to understand your current state.
I agree with you, Sandy. You can't fix what you don't know, so you just have to get the data flowing. If you don't have data in, you can't get data out. And then you can't look at where you're starting from in order to get better.
So in other words, we've got to start somewhere.
That's right. You have to start somewhere. For example, what's your practice's ability to pull their clinical quality measures? What do you know about your performance on those measures? Do you look at them regularly? And do you see areas to improve? Clinicians should also be thinking about what they know about their current cost to provide care for their patients.
You know, I would advise clinicians to get their 2014 QRUR if they haven't already done so. It's probably the best way to look at cost per Medicare beneficiary that's out there.
So, Susan, I'm somewhat familiar with the QRUR, Quality Resource Utilization Report. But for the benefit of some of our viewers out there, can you explain what you mean by the QRUR?
Sure, this is like a Medicare report card. The 2014 QRUR shows how groups and solo practitioners, identified by their TIN, performed in 2014 on quality and cost measures. CMS uses the results of this data to calculate the 2016 value modifier.
Quality is measured by the PQRS measures that you submit and the supplemental claims data. Cost is measured by the claims data for specific episodes of care to Medicare patients that are attributed to that practitioner.
So without turning this whole MIPS Tips newscast into a QRUR segment, can one of you tell the viewers how to get a hold of their QRUR reports?
Most likely, someone in your organization has already pulled this from the CMS security portal called EIDM, or Enterprise Identity Data Management System. Ask your administration who is the security administrator for your organization. If you're in an ACO, most ACOs already pull these reports and use them to look at each clinician's performance.
Now, if you can't locate the security administrator in your organization, Just Google how to access my 2014 QRUR to find a link to an educational resource guide that gives you step-by-step how to do this.
Love that Google. So now getting back to MIPS tips number 5, understanding your quality reporting performance score. You are suggesting we use the QRUR, the data from PQRS measures we submit, and any type of quality measure report we can pull from our EHR or get from an insurance company to assess our current performance.
That's correct. Then you want to think about, as a practice, what could you do to improve these scores? And which of these areas might qualify as a clinical practice improvement activity for the CPIA category for MIPS? Aligning these could reduce your burden and you would see success quicker.
So do you have any particular examples for our viewers?
Sure, a care coordination activity that is medium weight in the CPIA category. Partner with your hospitals for transitional care services. What is your practice doing to track admissions, ED visits, and discharges? If your systems can't talk, consider using a health information network in your area to be notified in a timely way. Then use this information to look for frequent flyers or patients with specific high-risk conditions that causes them to go to the hospital more regularly.
As another example, if you find that your patients with atrial fib or cardiac conditions are requiring more visits to the hospital, use your data to see if they're getting their preventive care, regular checkups, or if they're on high-risk medications. Think about what can you do in your practice to prevent the patient from needing hospital care. As another example, one of your quality measures could focus on fall prevention. Do you do fall screenings and offer tips to at-risk patients? Improving outcomes for this population could really reduce your cost of care, and it would be a win-win situation for everyone.
Kind of an easy one to start with, if you haven't already, is a timely access. It's highly weighted CPIA activity. You look at those ED visits. Are there outliers? For example, are there lots of children that parents are taking to the ED in the evening? Maybe the parents have to take them there because they have no way to get them to the office during the day. Maybe they don't have a car or they have work commitments. So they show up in the ER instead with their pharyngitis and their ankle sprains. Do you need to offer expanded hours in the evening and on weekends? Or do you need to coordinate with an urgent clinic to have access, so they have access to your medical records? Then you want to educate your patients on how to use that urgent clinic instead of using the ED.
So this has been really good, but I'm sorry to say that our time has run out. It's been another great segment of our MIPS tips for eligible clinicians. So Sandy, just because this was kind of complicated, can you do a recap for our viewers?
Well, first begin to understand your current performance scores by looking at the data from anywhere you get it. Your QRUR, your EHR Direct, your insurance companies. Then next, identify areas that are specific to your scope of practice. Where would you like to see improvement? For efficiencies, you try and align these areas with your quality measures and your clinical practice improvement activity. This produces better patient outcomes, reduces cost of care per patient.
Thanks, Sandy, and thank you for watching QPP News with Susan, Sandy, and Dr. Paul. Please join us soon for MIPS tips number 6, where we'll discuss steps to set quality goals and timelines for your practice.